Good news is your pelvis is a relatively small bucket. So one positive ripple in one of them can typically
You're listening to the In Your Pants podcast. I'm your host, Dr. Susie Gronski, your penis-friendly pelvic health physical therapist, sex counselor, and educator, helping you get in the know down below. So, Dr. Mills, talk to us about sexual recovery post-prostate cancer treatment.
Yeah. So being in the space as a male, I've treated a lot of guys that were in a space where they were struggling with their male identity as it relates to like the change that happens with their penis and the use of their penis following either this surgery or radiation. And I think it's important in our profession to be able to promote there being more males treating males, guys treating guys, however you want to say it, in a mostly female sector. I mean, it's kind of like it used to be women's health, right? The treating of the male pelvis was kind of like a fringe portion of that sector, right? And it's just recently changed into the pelvic health sector since what was it, 2015, 2016?
Yeah, not too long ago. I mean,
Yeah. So part of my goal is to kind of trailblaze there being, I guess you could say, more masculine energy in the men's pelvic health space. Getting the idea out there that it's okay for more male clinicians to want to treat this. It's not weird. It's not taboo. It's just, I say, orthopedics in a dark wet, potentially wet space. Like it's not all that much different. It's just you have more, educational conversations. You get into the nitty-gritty of habits, and you get into the nitty-gritty habits of like how habits apply to function. And you talk a lot about sex, which most guys talk a lot about sex anyway, or in certain context, right? A lot of the guys dealing with this struggle to talk about sex, and the preference of males wanting to be treated by males. A lot of guys seek me out because of that preference. And I think it's in a lot of cases an important part of the healing process and determining what is the thing that they want to get back to. In the older adult population, sexual drive isn't as strong as it used to be. A lot of guys immediately start their conversations with me with, my number one goal is to stop peeing on myself. If we can get the erection back, it's kind of like a secondary, right? Mm-hmm. And then I dive into, well, an erection a day keeps the doctor away. Like, it's an important part of your general health, right? So in gaining that back, we want to be doing things to encourage blood flow, like the daily Cialis, the Viagra, maybe even the shots, if needed, but also a somewhat daily use of the penis pump. And it's still going off of the idea that your body can't do it on its own right now. So we want to encourage it. So getting someone comfortable with the penis pump, and I talk about the how, the what, the why, and the when. Getting your brain involved. We don't want to be overly mechanical with using the penis pump as it relates to getting an erection back, because most erections begin with the brain. It's not just like stick this thing on there and light her up. Like that's not very arousing for most guys, but that's what most guys associate it with. It's like this thing that's going to suction onto their body, and it's just going to pull some blood into their penis. If that's how you're going into it, you're not retraining the pathways of how you would normally have an erection. So that's where I always start. And then it's graded gradual exposure. Leave it on for a couple of minutes. Once you take it off, we're going for self-stimulation, because it's all about stimulation. And then you just rinse and repeat that. And if you have a little bit of leakage while it's happening, it's fairly normal. But as we continue to work on general strengthening and normal tone to keep the gate closed, it's going to get better. But we want to do things to encourage as much blood flow down there as possible, both from a just penis tissue health standpoint, because use it or lose it, as well as, neural function. This is what happens whenever you get an erection. So.
Yeah, so important. And I'm glad that you're bringing up the importance of the overall health and not making it mechanical, but connecting that with a subjective level of arousal. So bringing in the brain and the experience of feeling aroused in general, right? Because if we don't have that on board, then anything else that you're doing just purely biomedically is not going to be as supported as it can be, with the element of the mental arousal or the subjective arousal. It becomes less mechanical. You're making the penis pump sexy. You may be introducing that, whether it's injections or the penis pump, with your partner. Like, how do you make it sexy? How do you connect with your erotic flow? Yes, things may be different. Your body, your penis may be behaving differently, but your capacity for pleasure is limitless. Right. So, how do you connect with your pleasure rather than the performance, which is a conversation that is a bit of a difficult one to have, right? Because the social cultural sexual narrative or script around penis owners and sexuality is that, your penis is a machine and it should work regardless, and always ready, always on, to be hard. And the only way to receive pleasure, to give pleasure, is when you have a hard penis. I mean, so there's so much entangled within the narrative, so many threads, and that piece is kind of, for me, again, when I'm working with folks, is like, we got to have that conversation of, can we reframe the experience of your sexual self, your voice? Not saying that that's not an important piece, right? But it doesn't have to be the only piece, an all or nothing kind of sexual engagement or sexual experience. How can we still experience pleasure in ways that help you connect with yourself and your partner? Anyway, it's something that clearly I'm passionate about.
Yeah, no, there's definitely a disconnect that happens, and depending on I think it has a lot to do with like the pre-existing notion of the patient prior to having the surgery. If the expectation was it's just going to work, or on the opposite end, if the expectation was it hasn't been working that well leading up to this change, it kind of sets the stage of what's going to be the case after the fact. So there's a lot of reframing that goes into that, and discussing what those expectations looks like for the patient, and then for the partner, and how the partner can get involved. I would say with most older guys, that most guys that have this, most males that are going to be having prostate cancer are older. The youngest I've had was 42. But the average is like 62 plus. So in that regard, they've more than likely been having sex a similar way for a long time. They're like in their groove, right? And introducing new things might be a newer concept at that stage in life, right? Especially, with the traditional age group, like that age group is a little bit more traditional. So reframing the idea, I find that a lot of times it gets through to them when I say, okay, well, so let's think of this as like you're getting comfortable with how to operate this and how yourself operates with this first. So you're comfortable, A, explaining it to your partner, and B, using it with your partner. Let's get you comfortable with it first. This is practice. This is game time. And that usually kind of knocks down a few walls as far as the reframing process goes. So
That's great. And the piece of that you said, Dr. Mills, about just being a clinician, when you're a guy, you have, your genitals are arranged in a particular order. Your experiences are that of, the identity that you hold, and just having a clinician to relate to, as far as I see myself in you, like I can relate to you. That is a very different therapeutic relationship that can be established there for sure.
right.
Especially if there's reservation around, oh, you're a female provider and I'm struggling, I'm a man struggling with these issues. It can be very difficult to just trust and open up in that space, and to be honest and authentic.
Yeah.
For many reasons, but the fact
Yeah.
that, you had mentioned that I think is a very important point, and that the more options that people have, the better, because there should be options for folks. If you have a preference and a comfort level, a trust level working with a particular person for whatever reason, that should be an option, and, we haven't even touched on the trauma pieces, right? So it just depending on that person's experience in their life and their history, having options within healthcare is tremendously important. So
Yeah, absolutely.
yeah. Around the sexual pieces so you had mentioned the pump, the shots. We talked certainly about making the genital and subjective arousal kind of being on the same plane, not separate from. There are some another benefit that I kind of want to add as far as using the pump. The research isn't conclusive on this, so I just want to be clear. We don't have much around this piece that I'm just going to mention, but as you're alluding to, biologically, if we're getting blood flow to this organ, if we're helping tissues be more pliable, flexible, and helping with the nerve healing, then that in itself may only make sense that the continence control mechanisms are going to improve too. So you may be seeing incontinence, but there are some literature that are alluding to the fact or proposing that, hey, using a penis pump and making that a priority in your rehab actually can help with the incontinence itself.
Yeah. Yeah. So I always explain in the initial framing that it's like, if we're talking about your issue as a pelvic health issue, it's in a bucket, and then there's 3 sub buckets: sexual, or 4: sexual health or sexual function, bladder function, bowel function, and then I say function, how those relate to just any kind of other function. And the good news is your pelvis is a relatively small bucket. So one positive ripple in one of them can typically have a positive effect on the other, and vice versa, right? So anything that you're doing I think that the research will continue to suggest that it's helpful on both ends. And I think it'll end up being based on the idea that like any kind of promotion of getting an erection is going to have positive effects to all of those tissues in general. But we'll see. But I think it goes back to the proactive approach, right? You're doing things, and I don't think that the use of the penis pump should just be independent. I think it should have a lot to do with everything else. It's like a whole package deal. But yeah, I mean, one positive change in one of them has positive changes in the other. So like when I'm having the discussion with the guy of like, they're very pro, I just want to stop peeing on myself. Sex isn't really on my radar anymore. I don't really care about sex currently. I see a lot of that. And the conversation is, well, I understand your norm right now has been, you just want to stop peeing. You want to have control of this part of your body. And the last thing on your brain because of that is having sex. But it is going to be an important part of your recovery to improve upon that as well. That's typically how I go about that conversation.
Yeah. And what are your thoughts of the penile vibratory stimulation, aka vibrators for the penis, especially for sexual recovery? What role, if any, does that play in your recommendations for folks?
I haven't gotten too much into that. Usually because the penis pump usage paired with everything else seems to be enough. But when we're talking about stimulation, I mean, there are that falls into the category of with other forms of stimulation. And I think it would be a great addition. It's just for most guys, we haven't gotten to it, if that makes sense. But that is a newer, interesting part of like therapeutic modalities. That, and I know Joanne has been doing a lot of shockwave for erectile, which is interesting because it's like, 7 years ago, you go through PT school and shockwave therapy and real time or therapeutic ultrasound are like we've been doing this for a long time, but it doesn't really seem to be helpful. And then now it's come back for like penile health, which is just, it's interesting how things like wax and wane from a application standpoint, right? Most things that have been done therapeutically at one point or another in the space seem to have a certain level of application for a certain part of the body. So I'm very pro exploring all of those different modalities as far as, if there's some research to suggest that it would help, well, let's try it. Let's include it as a piece of, building kind of this pyramid of, at the base level, all of the things that we've talked about from a habit standpoint, coordination, that's to get you started. And then we're just building it upward. So.
Exactly. No, thank you for answering that. I mean, there's a lot of it with the shockwave and, using vibrations, different forms of stimulation, as you mentioned. It's just another way to stimulate. And for some, it may be very helpful. And for others, it just may not do much. But we really, as far as conclusive evidence and data around these modalities, that has still yet to be determined. So we can't really say for certain, guys, but we do think outside the box, and we're just sensible, biologically plausible rationale for why particular modalities or treatments may be beneficial for someone, but that's not separate from the individual in front of us. We have to take into consideration certainly your experiences, your physical health, the examination process, and really what's important for you as an individual, and if a particular suggestion is even on the table for you. So there are many ways, as Dr. Mills has been explaining to us, to go about this in these boxes, not boxes. What did you mention? Bubbles. Buckets. Oh, buckets. Like
Yeah.
boxes, bubbles, buckets. Got it. Okay.
Close. Yeah.
So yeah, buckets. There are many different ideas in these buckets. And if we make one change, as you said, it's going to influence all the others. And that, I think, is just a beautiful thing. And knowing that our body is always changing, and there is this concept of bioplasticity and neuroplasticity and adaptation. And so how do we take advantage of that? And
Yeah.
this journey is going to look different.
And how it's applicable to, so my grandpa always used to say, like, oh, well, I remember him for like my 21st birthday. He's like, how old are you again? Or how old are you turning again? Oh, you're 21. You're just a spring chicken, right? So like a lot of my older guys love that term. So I say, you're not old, you're just not a spring chicken anymore, right? so it's like, even when you're not a spring chicken anymore, it's like your body's it's still the human body, and it's still very adaptable. It's not just, oh, well, I'm over 30, my body is just falling apart. That's not what we're trying to promote.
Exactly.
You have the ability to come back from things. You just have to give it a nudge in the right direction, or 1,000 nudges in several different directions.
That's right.
Depending. Yeah.
That's right. I love that. Exactly. So wonderful. Well, I so appreciate you doing this special series with me,
Yeah.
Dr. Mills. I
No,
really
this was great.
appreciate your time and your wisdom and your experiences. Where can folks connect with you? Where are you on the socials, your website?
Yeah.
Shameless plug away.
Sure. So I'm on Facebook and Instagram, just as docmills.dpt. I recently started doing more streaming on Twitch. There I'm Doc Mills DPT. If you went on my Instagram, you could click on all of my links. And then the website is my clinical website, alineaperformance.com. Alinea is, the clinic and the sphere of how me and my business partners, we have locations. Oh, well, let me shameless plug the locations. So I'm in Baton Rouge. We have a location in Tampa, Florida, Cincinnati, Ohio, and then we just added Fort Worth, Texas. So it's currently four clinical sites, and we're all treating men's pelvic health,
Wow.
both in person and virtually. So if you're looking for us, if you went to our main site, it could direct you to all of the sub sites, alineaperformance.com, and we could put that. I'll send you all that good stuff.
No, that's perfect. And those resources are already on my website, drsusieg.com. Under resources, there's a table that has health providers, and you will find Dr. Mills' information and website under the locations. So that's wonderful. Yeah.
Great.
Thank you so much again for all you do and for your advocacy and support in the men's health space.
Yeah.
We really so desperately need more of you.
Yeah. Thank you so much for having me. This was awesome. This was like kind of like a long time coming thing that I've always wanted to do. So.
Oh, great. Awesome. Well, thank you. This was fun. And to all of our viewers and listeners out there, thanks so much for watching. And as always, in loving wellness for your pelvis, this is Dr. Susie. Until next time, bye. Thanks for listening to today's episode. Be sure to visit my website, drsusieg.com, for show notes and related resources on today's topic. If you like what you're hearing, head on over to YouTube and subscribe to my channel. On my YouTube channel, you'll find content related to sex, pelvic health, and expert interviews for men. If you got a question or a topic that you'd like me to answer on my channel, be sure to type it in the comment box below.